In this video, you'll learn all about testicular pain and atrophy on TRT. Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe. I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video.
One more time, you can do it.
Testicular.
There you go, guys. Testicular. It's a very, very hard word for him to pronounce. We're going to talk about testicular pain and atrophy.
Thanks, Danny. Go ahead.
So, a lot of you guys getting on TRT are asking your docs for something called HCG, or maybe your docs are telling you should take HCG. HCG is primarily taken for fertility to keep sperm count good, but it can also, it has other benefits if you want to call them that, but one of them is to prevent testicular atrophy. So when you're taking just testosterone, your testicles will shrink a bit. It will vary from person to person. It did occur with me, and the shrinkage was, I mean, maybe 20%, maybe. It's hardly noticeable, and I like everything else works fantastic, and I feel great.
Who cares?
But I remember going through some discomfort when that process took place. And it seems that with certain guys, that pain or discomfort when they shrink a bit can be stronger in some guys, and other guys don't feel it at all. There have been guys that reported that it's so much pain and cramping and discomfort and they can't take it, and they get on HCG to prevent that from occurring entirely because it's just too uncomfortable for them. Couple of things here. If you're already suppressed, so let's say you already have really low testosterone levels, you already have some suppression, which means your testicles have probably already shrunk considerably, or the amount that they would shrink, that process has probably already occurred. So if you're going to your doctor and you're like, oh, I've got test levels of 250 and the range is from 300 to 900 or whatever it is, you have to understand that shrinkage probably already took place. Okay, so if you're going to get on testosterone now, the testosterone isn't going to make them shrink more. They've already shrunk. You've got other guys that are, they have fairly healthy levels of testosterone. Their testicles are more or less functioning, but they're having symptoms of low T. So they get on TRT, and by getting on TRT, now that shrinkage, if you will, occurs. And again, it can vary from person to person. Some of them it occurs, it's mild at best. They don't feel anything. There's no discomfort, nothing. Then you get the other end of the spectrum that it's more. That pain and discomfort for those of you who get it, it doesn't really last very long. It could be a week, maybe 2 weeks, and it's not like 24-hour pain. It'll kind of come and go in waves. In my case, I was probably in the middle. I remember some nights that, like, I sometimes sleep on my stomach. I couldn't sleep on my stomach because they were getting pressed down, and it was uncomfortable. Sometimes I felt it when I was walking, and I was really anxious for the pain to go away, but it did eventually go away. So for those of you that want to take HCG specifically for atrophy, again, you got to keep in mind that the atrophy is usually very, very, very minor. If you already have suppressed levels of testosterone, there's already going to be some atrophy that you've had, so they're not going to shrink anymore. But there's some guys that are really obsessed with the size of their, gentleman vegetables, or whatever else you want to call them, that they want them to be full. In that case, you could take something called HCG. So HCG is basically breathing life back into them. There are some guys that report feeling better with HCG. There's a whole bunch of other guys that report not feeling as good at HCG. I was one of the ones that did not feel good at HCG at all. I'm finding less and less and less that are feeling good with HCG. Most of them have ditched it and have just increased their dose of testosterone and have accepted that their testicles are going to get a little bit smaller, and it's really not that big of a deal. Again, if you do get that discomfort and pain, my suggestion was just try to ride it out. It's temporary. It's not something that's just going to last forever. There is discussion in regards to if you don't take HCG, that eventually the Leydig cells will die out, and that it can affect libido and orgasms and a whole bunch of other stuff. I'm yet to see anything conclusive about that. It has been reported to me a few times. I need to look into it more. The reason I find it, I guess, a little hard to accept personally, I've been on TRT now for almost 5 years, and I don't have that issue like in the slightest. If anything, those things have improved. I've spoken to guys that have been on TRT for over a decade, some even 2 decades, some even 3 decades. And that hasn't occurred with them either. So is it just something that occurs in some men and not others? Yet to be seen. My personal position right now, and again, my position could change as new evidence comes in, but my personal position is if you need to be fertile right now, take HCG right now till you get the job done and then get off it. Okay, try to get dialed in with testosterone only, I think is your best bet. I don't think anyone should really worry about a little bit of atrophy. It's a non-issue. I think no one really, your significant other is not going to care about the size of your testicles. They're going to care that everything else works the way it should. I think that's what's kind of most important, that you feel good. So I guess that's pretty much all I could say about it.
Would that testicular pain be dose dependent, Danny? Would there be any guys that have not experienced that and then they have to augment the dose and then they experience this hypersensitivity?
No. So any amount of exogenous T will cause that to happen regardless. You will get suppressed. Even if you say, I'm just going to take 50 milligrams a week, I'm going to take a little bit, guess what? You're still going to get suppressed. And as you get suppressed, you're going to get that atrophy. And like I said, every guy will differ, but some won't feel any discomfort. Some will. So that's going to happen regardless if you're taking 50 milligrams, you're taking 500 milligrams, it's going to happen. So I wouldn't start adjusting dose based on, I've got that discomfort, I'll adjust my dose. It's not part of the equation. What some guys are doing, if you take the extreme guys that are like, hey, as soon as I start getting that atrophy, the pain is unbearable, they hop onto HCG to bring life back to them, and then the atrophy doesn't occur, the pain goes away. So that's like kind of putting a Band-Aid on the situation. You're just saying, I'm going to take this other drug, which is basically from the urine of pregnant women, to keep my testicles working well, which could cause a whole other slew of issues, just so I avoid that a week or two of atrophy that may cause a little bit of pain. Personally, if I had to go through it all over again, and let's say if I had to go over it again, the pain or discomfort would be even more than it was, I would still just try to ride it out. I would still just take some Tylenol or whatever I can to keep that under control, because I know it's not long-term. I know it's not permanent. Mm-hmm. I know I'm not just going to have this pain and discomfort for the rest of my life. It's going to, they're going to shrink a little bit. And during that time, there's going to be a little pain, and then they'll just stop, and then that'll be it. And that pain and discomfort should disappear.
So temporary, we're talking weeks, not months.
Weeks.
Okay.
In
just
my
people
case,
know.
I could say the pain, discomfort, which is again, what in my case was minor, probably lasted about 2 weeks. And then that was it. And I remember showering, like, yeah, they get maybe a little bit smaller. I even asked my wife, and she's like, she's like, I'm not there checking and measuring the size of your testicles every day. Like, I don't know, maybe a little bit. Like, for her, it's irrelevant. But the pain, discomfort, in my case, probably about 10 days to 2 weeks. And then that was it. Okay. But I personally felt beyond horrible with HCG. Again, there's some guys out there that are saying, yeah, but I take the HCG and I find it's better for libido, and I find it's better for seminal volume, and I find it's better for, all these other things. But I wonder what would happen if they removed the HCG from the equation and simply increased their testosterone dose to compensate, achieve the same levels of testosterone they had when they were using testosterone and HCG together. Would they feel just as good? Mm-hmm. There's a bunch of guys that have emailed me and they said, I'm going to try what you're suggesting. They've tried it and they would say, hey, I actually do feel better, if not, I feel the same, if not better than before without the HCG. Mm-hmm.
Yeah. Okay. Thank you, Danny, for sharing these very intimate details and topic. Okay. Talk to you later.
Talk to you later.